I have a condition called neurofibromatosis type 1, a condition where tumours grow on the end of your nerves. It makes it feel very painful and it brings you right down and you can't do anything. And it was in my left leg and it was 4 times bigger than my right leg. So I couldn't run like my friends could, I couldn't play football, I couldn't do anything. I had to rely on my wheelchair to get me around.
When he first approached us at the age of 8 for amputation, he'd already researched rehab. He knew exactly what was involved. I think we were a little bit taken back that was his idea of the way forward. But to be fair to him, as his leg progressed to get worse year upon year, it was always going to be the inevitable outcome.
After having my operation, it completely changed my life for the better. I've never been happier. I've got my new leg now and it's a very long process to be able to walk completely. So now I'm on some sticks and I'm hoping in the near future to be hopefully walking around and with my friends and having a good time.
I have a really rare bone disease in my right leg, right along the tibia, which bows my leg in the shape of a banana, and it's got tumours all the way up it, and yeah, it's not very nice.
Lewis has a rare bone disease called osteofibrous dysplasia. We found out when he was 8 years old. He'd had an accident at school, he'd bumped into a table, came home complaining of pain. A few nights later he was playing football in the garden with my husband. My husband was wearing flip-flops and caught Lewis on the leg with his flip-flop, and Lewis was screaming in pain. So we whizzed him up to A&E, and before we knew it, all these doctors were in the room. We were in this tiny room. They'd closed the door and they sort of said to me, "We've got something very serious to tell you. Lewis has got what looks like fibrous dysplasia, and his leg," Lewis described it when he was younger as mouldy bread, because that's what it looks like. His bone is bowed, sort of in the shape of a D, and all down the bone there's just black tumours. At that time he had 9 tumours on his leg, but as it stands now he's got over 300. And the tumour side of it is called adamantinoma, which is a rare cancer, doesn't respond to normal cancer treatment, and the only thing they can do at this stage is an amputation, which is imminent.
I just carry on really. I want to be active as I can, even though I'm in a wheelchair at school.
Oliver was diagnosed at 20 weeks with renal pelvis dilatation. He was a miracle baby. We didn't think we were going to have children. We'd lost 3 previously to him, so we were obviously very excited, but the whole way through the pregnancy we were quite worried. And it wasn't until he was born that we found that actually it was more serious than everybody had thought, and he was diagnosed with grade 3 kidney reflux and partial renal failure on both kidneys. He's a really happy boy. He has some understanding of his condition. He knows he has poorly kidneys, and he will happily tell people, "I have poorly kidneys, I have reinfections, I stay in hospital." He likes hospital.
Last summer he was in the hospital for a block of 6 weeks solid. The whole of that year he was on the ward the majority of the time.
He loves coming home to school. This is what I've had for the last 2 weeks, is when can I come home, I want to go to school. And it was lovely seeing him go back last week, and all of his friends were calling him and everyone was so excited. They'd made him a get well card and he just absolutely loved it, to the point that where I've had to be pulling him out this last week to go to blood tests and things like that, he's been in tears because he doesn't want to go. He's quite matter of fact about it. "I have blood tests, I have cannulas." I think if you ask him, he'll show you his hand at the moment. It's black, where he's just covered in bruises. He had about 20 blood tests in 12 days. I've never known a child like it. Even when he's been really, really unwell, he just gets on with it.